Ready?
Mute all except Michelle. I have to unmute Michelle.
Hello?
Michelle, can you unmute yourself, please? I can't unmute you. Yeah, good. Perfect.
Yeah.
So,
Can you hear me?
yes, we can hear you. So most of us, we know Michelle. If you don't know Michelle, so Michelle's full name, Michelle De Leon. She is she has completed her BSc physical therapy and been working as integral staff member at iMotion in Fremont location. She started with Los Gatos. She transferred to Fremont, and since last several months, she graduated from De La Salle Medical and Health Science Institute in 2018, which is in Philippines, and she traveled from Philippines to California with ultimate challenge to improve herself and making difference in the patient's life. She has been amazing physical therapist. Generally, we have this anxiety to bring the new grad for our patient, but she was never as a new grad in the office. She was like a very experienced physical therapist. Her treatment, and up to the extent patient do complain the soreness after her treatment, which is a good thing. We love it, right? We get paid for that. So, no, but
Sorry,
in
George.
a good way, obviously. So that saying that, today she is going to talk about the healthy tips for the posture for working from home. I already got several emails about moms concerned about kids posture, and I totally get for me having two little ones, and it's terrible, right? Even when this whole digital world was not there, moms always say sit straight, keep your spine straight, right? So now it is more important. So I totally understand the concerns from all moms. So Michelle is going to answer those questions during the presentation, and we have tried to make less theoretical as much as we can and more interactive and more you can implement in day-to-day life. If you have any further question after the webinar, feel free to email us, call us. We can do even telehealth consult. If you want us to check the uh, workstation you are already working or kids are working, take a picture of kids and feel free to email me. I'll write my email Kashmira. I want to introduce Kashmira too, but this we will be there to help you even post a webinar session. So feel free to utilize the expertise of the physical therapist that we have on board. And if Michelle can put camera on Kashmira, she is sitting next to her. This is Kashmira. She is a clinical director. She runs the show in Fremont Clinic. If you have any complaint about Michelle, feel free to tell Kashmira. And Michelle,
He's not here right now.
so even for me, actually, she is my boss in the clinical side. So I have to report Kashmira too. So she is a big boss in Fremont Clinic as a clinician. So I will let Michelle get you started, and I'll mute myself first because I talk the most. So, all right, Michelle, it's all yours.
Okay. Oh, I think you've disabled me from screen sharing. But anyway, hello everyone. My name is Michelle De Leon. Again, I'm a physical therapist here at iMotion Physical Therapy, and I would like to thank everyone for coming, taking time out of your day just to join us on our little webinar today. I hope everyone is staying safe and patient and busy during our ongoing pandemic. And my goal today is to create for you a short webinar as a resource for those that are working at home. And I hope I can provide for you some tips to keep you healthy posture while working in the home environment. And not only that, but I also want to share some general rules to increase physical and mental health in these trying times. Okay. How do I okay. Share. So most of us are probably working or studying from home at the moment, and to make things a little bit more interesting, even our kids are also at home studying or doing their classes online. So these are also some things that you can have your children do. So let's get started. Okay, so let's all be honest. How many of you guys are currently on your couch looking like this, sitting and watching this webinar? And if not, how many of you might even have one foot up for comfort? You could also even be laying on your bed just this very moment. Or if you're trying to be a little bit more comfortable, you're probably even on your side right now, just very comfortable. And so, um, yeah, if you find yourself in any of these positions, most likely than not, you're also working in these positions at some point throughout the day. And it may seem very convenient, but what most of us may have already realized is that these cause pain, aches and pains, headaches, things that we normally wouldn't encounter when we're working from home. Oops. And and you're probably thinking, oh, if only I can go on throughout the day without aches and pains, then I'd probably be able to enjoy those hours where I'm not actually working. So if you want to survive the next few weeks without any horrible headaches, neck pain, shoulder pain, there's a few things that you can do to help. So first, let's talk about why is keeping a healthy posture important. So it's been about 3 months since this new challenge came upon us, and with so much stuff to worry about during our ongoing pandemic, maintaining a healthy posture isn't really our priority. We have work to think about, deadlines, projects, cooking, cleaning, the kids, teaching the kids. So thinking of proper posture doesn't really come to mind, or it's most likely thought of as a burden. So yeah, but maintaining a healthy posture is actually one of the best tools for you to prevent any injuries and improving your long-term health in the long run. And is essential to form self. It is an essential form of self-care per se. So not only should you be taking your vitamins, drinking enough water, doing your exercises, you should be also um, thinking about your posture. So having a healthy posture habits prevents common neck, shoulder, back problems and improve your move and energy throughout the day. Setting up ergonomic workspace at home will decrease stress by allowing you to work with attention to your health and personal comfort. So ergonomic was developed to help reduce risk of aches and pains in the workplace by maintaining a neutral posture. And regardless of what industry you work in, what your position in is in wherever you're working, if ergonomics is applied correctly, then you'll probably most likely have less pains at nights. So there are actually a lot of different studies about ergonomics and why it's good for you and for our bodies. But basically, when we work in a neutral posture or position and move throughout the day, we're increasing our body circulation. And this is how our bodies gets rid of the waste that our body produces. Those are the things that make us feel run down and fatigued at the end of the day. And for those of you that work out and get sore at the end of the day, and it's because of the lactic acid, those are the ways that your muscles create. And but here's a fun fact: even when you're in one position for too long, our body is still producing that lactic acid, and that's what's causing you aches and pains at the end of the day after working, even though you didn't really do anything strenuous. You were just on your computer. So that's why, because the lactic acid buildup is causing you those pains. And actually 80% of office workers report work-related aches and pains, and 33% of those can be prevented through proper ergonomic design. So if we apply the ergonomic design in our daily lives, then we would most likely prevent injuring ourselves and getting any aches and pains at the end of the day. So here are some of the problems commonly seen when we're working from home. First, we don't have the ergonomic workstation. We don't have the fancy chairs, the fancy desktop that we have at work. We probably don't have that standing desk as well. And we most likely, or most of us, wouldn't have a home office. So you're stuck in the dining room, in the kitchen, in the living room with kids running around. So that makes it a lot harder as well. And we're working for 8 hours straight without any breaks. And you also have to take into consideration cooking for the kids, taking care of the family. Or you may have an ergonomic workstation, but some of you may still be having these aches and pains. Another thing, we probably have neck, shoulder, wrist pain as well. So I'm going to go over some general rules and tips. Number one is use a shaded workspace with a table and a chair, meaning ditch the couch, ditch the bed. And the main idea is you're not blending your personal life with work life. So a dedicated space for rest and one for work. As tempting as it may seem, we should draw a line that helps create a work-life balance. And not only that, but when you're in positions or places that you normally associate rest with, you may tend to feel sleepy or not work as efficiently throughout the day. And I see these with several patients of mine. They're having pain with sitting, so they go for the bed or they go for the couch because it's more comfortable. But in the long run, it can actually cause you more harm because you're in those positions for prolonged period of time with your neck all bent and your body just isn't in the most optimal posture. Next, you should also find a chair with a back support. When our chairs don't have back support, our tendency is to slouch down because I know it's hard to even think about maintaining your torso upright. And so a good back support will definitely help with that. Choose a space that's well lit. Natural lighting would be preferred actually. Some people may prefer to work in a dungeon-like environment with all the windows are closed and all the lights are off, but it can actually cause some eye straining because of the bright light coming from the laptop, and that will also not be good for you. Next, you should also choose a location that minimizes distractions and noises, just so to help you work more efficiently throughout the day. And next, limit prolonged laptop use. This may be difficult for some of us because most of us only have laptops, including myself, and not everyone has the fancy desktop at home. And one particular reason why we have those aches and pains is the way our laptops were made. The screen is attached to the keyboard. The keyboard isn't really big enough for most of us, and the mouse track is right in front of the keyboard. So we're having to do these awkward postures and positions just so we can use the laptop altogether. Um, you may find yourself with your head down, your shoulders hunched over, and your hands like this over the keyboard. And that will definitely cause you a lot of pain because it creates a very suboptimal posture. And a quick way to help you prevent those aches and pain is just like here in this picture. We've elevated the laptop just around eye level. And if you have an external keyboard or an external mouse, that would be very helpful too. Most of us have this lying around the home when from our old desktops. So yeah, that's one way. Three, be cautious of those ergo fads. You may be excited and thinking, oh, I'll be working from home. Let me go on Amazon and get an ergonomic keyboard, an ergonomic mouse, an ergonomic chair, and all those expensive fancy things. And just so you know, not everything is built equally ergonomic for everyone. Ergonomic has to do with the fit for the worker and their environment. And so just because it says ergonomic, it may not always mean that it's the right product for you per se. So be really careful and be cautious with that. And a perfect example is this ball chair. As you can see, it's when you actually use this medicine ball, it helps with core activation, everything. But the way, if you see here on the top picture, the guy isn't really using the back support. And if you can see, his knees are a little bit more bent than preferred, and he's still kind of having to hunch over while reading his book. So although it's quote unquote ergonomic, it's actually not doing him any good. So yeah, those are things that you need to keep in mind of how these ergonomic furnitures or devices are actually fitting for you. And next, this is one thing that a lot of my patients are guilty of, is not taking breaks. So taking breaks every 20 to 30 minutes can help boost productivity. It is important for our mental health and physical health by allowing us to stretch, regain motivation, and to boost creativity. So as I've mentioned earlier, constant movement helps increase circulation in our body to help reduce those aches and pains that we have at the end of the day. So taking frequent breaks is very important. Taking a break at least every 30 minutes would be good. And if you have difficulty remembering to take a break every 20 minutes, what I like to do when I'm working on the weekends with paperwork, I like to set a 20-minute timer every time, and every time it rings, I'm reminded, oh, I need to get up, go pee, go get a drink of water. And it really helps me remember to not do that to my body. And another tip that one of my patients gave me actually is she always keeps a water bottle on her desk, and she always tries to take or drink often. And after a few minutes, maybe 20 minutes, she has the urge to pee. So not only are you tackling two birds in one stone, you're staying hydrated, you're moving, you get to stretch. So it's all very good. So that you can start doing that or adding that to your general routine. And you can also do some stretches. Later, I'll be going over some quick exercises that you can do at home when you take your breaks. Okay. So I'm just gonna go over just the office ergonomics. I know everyone has access to the internet and they can just Google office ergonomics, but I'm just gonna go over it very briefly just so that everyone is up to date. So again, the monitor should be up on eye level and on arm's length way. The keyboard should be in line with the elbow. Hand rests prevent the hands from bending, and adjust the monitor slightly forward and sit upright. Knees and elbows at the right angle and to prevent pain. And this is one thing that a lot of my patients also forget is they, although everything is correctly placed, they forget their feet, and their feet might be dangling on the floor. So you have to also keep in mind of having your feet planted correctly on the floor. So here's what it's supposed to look like in both sitting and standing. And another thing to avoid is repeated neck rotation and bending. So when you're at home and you're on a meeting or doing paperwork and you get a call, we tend to do this little number right here where, like, for example, this is my phone, or here, our phone. We tend to do this little number right here where we hold our phone in between our head and our neck. And 20 minutes later, conversation's done, and oh wow, my neck hurts. So those are the things to keep in mind. Things to do to prevent that from happening: have the call on a speaker, or you can use headsets. And I'm pretty sure everyone has one of those, so no need to buy anything fancy. So again, here are the general rules. Keep arms close to the body and the shoulders relaxed. Keep your wrist straight and avoid bending wrist. Keep elbows at 90 degrees. Keep your knees at 90 degrees as well, and keep your feet planted on the floor. So here are some common ergonomic errors. These are usually when you're in the dining room, in your office, or in the kitchen. So as you can see, he's using a laptop, no adjustments at all. He's has on this first picture, he's looking down on the laptop with his arm a little bit bent, and you can see that his back is hunched over and his arm is away from his body. His knees are a little bit more slightly bent than normal, than accepted, and if you can see, his feet aren't completely flat on the floor. Over here on the next picture, you can see that our model is, although his feet are planted on the floor, his seat height isn't high enough, and so he's having to bend his elbows a little higher, and he's still hunched over and with the head looking down. And here's another one. Although his arm height and his feet positioning are correct, he's still having to look down on his laptop, causing him to have a hunched over posture with his neck forward. So being in these positions will definitely cause a lot of pain, because not only are your muscles back on your neck and your shoulders will get very tense at the end of the day. And here's another one with him lying on the bed, again, looking down with his hand positioning. His spine is completely bent and just very comfortable, but very painful at the end of the day. And here's a way where you can modify your laptop or your workspace. So we elevated, again, the laptop screen a little bit around the eye level. He's using a keyboard and a mouse, and the feet are completely planted on the floor, and the knees are about a 90-degree angle. And as I've mentioned earlier, standing and sitting can be intermixed. If you want to use a standing desk, it's also important to keep those measurements in mind. As you can see on this first picture, you may think, oh, I'll just use my counter as my standing desk. But if you're in this position with your trunk bent forward, your arms are kind of away from your body, and your wrists are kind of bent, that will cause aches and pains in the long run. So those are things that you can avoid. So here are different ways that you can create a standing desk. You can use a bookshelf. Most of us have that in our homes. Just put your laptop at eye level, and again, the keyboard at about elbows length. And here she's using a big box with her screen a little bit elevated with books and a keyboard instead of using the iPad as her device. And here's another one. I think this one can be purchased, but again, you can use things that you have at home, just so that you don't have to purchase anything. And hopefully we don't have to work at home for too long, so that these won't be necessary to purchase. And for example, you're in a Zoom meeting, you're in meetings all day, you can transition from sitting down to standing up while doing your meetings. So for now, even I can go stand up right now, but I don't want to have to move the laptop. So here's another way you can create a standing desk. You can use a fireplace. The model over here is a little bit taller than usual, or than normal, so we had to use a lot of boxes, but don't worry, your laptops will be safe. So yeah, just elevate the laptop, do your Zoom meetings or your conference calls while standing up. So here is a guideline that you can use for an ideal work pattern. So most of us work for about 7.5 hours a day. So this gives us a total of 5 hours of sitting, 2 hours of standing, half an hour to move around, and 16 sit to stand transitions. So like I've said, it's important for us to take a 30-minute break every time. So in that 30 minutes, you can sit for about 20 minutes, standing in neutral position for 8 minutes, and then save 2 minutes out of that 30-minute for moving gently and stretching. So that's the time when you can go get a sip of water, go use the restroom, go yell at your kids for misbehaving, stuff like that. And so you can go actually on this website, on the Cornell University website, where they talk more about this ideal work pattern. One thing I also wanted to talk about are eye strains. So when we're working, we're looking at screen for prolonged periods of times. Even when we're not working, we're looking at our phones, we're watching TV, we're looking at our iPads, and the screen brightness can definitely cause strain on our eyes. So what you can do to prevent that is you can do the 20-20-20 rule. Oh, how? It's 2020 and it's a 2020. Anyway, so yeah, every 20 minutes, look at something 20 feet away for 20 seconds, or you can close your eyes for 20 seconds every 20 minutes. Oh, sorry. Oh yeah, I'll show you guys that later. So again, I'm just gonna go over things that you can do at home to adjust your workspace. So common problems with common solutions. So if you're on your chair and you don't have enough lumbar support, you can use a rolled towel as a lumbar roll. And if your monitor is too low, like in this picture over here, and if your monitor is too low, you can use a stack of books or boxes, just like in this picture. If you're not blessed like me, where your feet don't touch the floor when you're sitting on a chair, you can use a shoe box or any sturdy box, or even if you have a footstool at home, you can use that as well. If you're starting to have some uncomfortable wrists and hands, and you're starting to get some numbness in there, you can try to switch your mouse position. You can opt to use arrows and enter keys as alternative to mouse clicks. My parents do this. They type very loudly. I don't know why. So you can try to reduce the force when you're typing. And here's another trick. I just found this about a month ago. You can use your voice to text option. So it's kind of like Siri, where you dictate and then it automatically types it out for you, just to give you a break. And if your laptop has it, why not use it? And again, if you have neck pain with phone calls, you can use your speakerphone or your headset, just so you're not doing this number when you're on long meetings or phone calls. And if you're feeling a little fatigued at the end of the day, you can take a walk outside over lunch. Again, consider the lighting of the room and the screen, and stand up and stretch. So I'm gonna go over some quick and easy exercises you can do at home. Does anybody have any questions before I go over these exercises?
Do you have the link for Cornell's website, which you can
I'll
post
have
it on the?
to, I can post it afterwards, or do you want me to do it now?
Yeah, you can post it after, but
Okay.
we can post it here
Okay.
before we end, because once we end the webinar, then it will delete it. So we want
Okay.
to make sure, and feel free to email me, and I will, when we update, when we upload it on the YouTube channel, we will put the channel, we put that URL for Cornell in that one too. So you will
Okay.
have multiple ways to get it.
Okay. Okay. So here's a little link from the back to school, where they teach you different exercises for an ergo break. I'll go over some of them and teach you proper ways to do them. Okay. Okay. Can they see me? They can see me, right? Okay. So first we'll start with some wrist stretches. So when you're on your computer all day typing, we tend to have pains on our wrists and our arms. So one stretch you can do is called the wrist extensor stretch. So you're basically going to be, you can do it standing or sitting with one arm in front of you with palm facing on the floor. You're going to use your other hand to grab the wrist, the hand, and you're just going to bend it until you feel a little stretch over here. You should feel a gentle stretch, and if it's starting to feel a little strained, you can just move the hand a little bit forward just to relieve a little bit of that pain. You can hold this for 15 seconds at a time and repeat for 3 repetitions. Okay? And next is the wrist flexor stretch. So it's basically the opposite. Right hand in front of you, palms placing on the ceiling. Grab with your other hand and just stretch. Again, gently, just a gentle pull on the top part of your arm, just like that. Okay, next for scapular retraction. So this will prevent you from doing this hunched over look. So what we want to promote is opening up the front and kind of strengthening those back muscles so that you're not hunched over all the time. So to start with, we're going to have a person stand upright position with arms directly to your side at about 90 degrees, and you're just going to squeeze your shoulder blades together. So one mistake that a lot of patients do is they tend to shrug up, and that's because their back muscles are weak. So it's important to just focus on those back muscles and relax. And again. Oh, sorry. Okay. So for 10 repetitions as well, and then make sure that your back is relaxed and shrug your shoulders. And next is our corner pec stretch. This you're gonna be, you can use a door or a corner of your wall room, and you're just gonna have your elbows at shoulder height, just like this. And you're gonna slowly lean forward, taking a small step. You can actually do this with me if you would like. Should I have? Okay. Yeah. Okay. So for this one, you're just gonna slowly lean forward, taking a small step if needed, until you feel a gentle stretch right over here on your pecs. And then make sure your upper back and neck are relaxed, because sometimes, again, people tend to shrug just because they're having neck pain and they're trying to guard that area. So important thing is just a slight stretch here in the front, and then the neck and the upper shoulders are staying relaxed. Next are some core exercises. I included some basic core exercises just so that we can activate a core. This is actually very important when we're sitting for prolonged periods of times, because when our core is weak, our back muscles tend to compensate, and that's why you're having all that back pain. So one exercise you can do is a dead bug. This is very basic. You're just gonna lie on your back, just like in this first picture over here. You're gonna raise your arms straight forward with lifting your knees to a 90 degree, and then you're just gonna hold this position for about 30 seconds. And one major thing that you need to remember is keeping your core engaged and to continue to breathing evenly, and do not let your back arch during the exercise. Because most of the time when patients have a weak core, what they tend to do is they arch their back because their core aren't strong enough to lift the legs up. So important thing is really activate the core and make sure your back is touching the mat or the table you're on. Next is our supine 90-90 alternating toe touches. So again, same position, you're lying on your back with your knees bent, and you're just gonna slowly touch your toe to the floor. And then again, do not let your lower back arch during the exercise. And this one everyone can do with me, because we all need a standing break. I don't know how long it's been, and I've been talking about it a lot, so this is one thing we should do. So for this one, let's all stand up, standing upright position with your hands resting on your hips. slowly arch your trunk backwards and hold. If you're having a lot of pain in this position, try to go a little bit higher just so that we don't injure anything further. Then make sure that you're maintaining your balance during this exercise and do not bend your knees. So again, you can hold that for about 10 seconds and up. And again for 10 seconds and up. You can repeat these exercises for 10 repetitions, 5 to 10 repetitions at a time, just so that you can get through more exercises when you're taking your breaks. Next is our standing hamstring stretch. You can do this standing, obviously, and what you can do, you don't need a step for this one, you can just use the floor. So what you'll do, I'm stretching my right leg over here, heel on the floor, and you're gonna slowly bend forward until you feel a gentle stretch right here. Let me use this side. You'll feel a gentle stretch right here on the back of your thighs and hold it. Try to make sure that your knees stay straight and that you are not arching your back. Okay, again for these, hold for 15 seconds and repeat it about 3 times. Next is our supinepiriformis stretch. So a lot of patients complain of pain on their glutes when sitting for a long time. And one muscle that gets really tight is this muscle. And so you begin by lying on your back, just like on the picture. If you want to stretch your leg, your right leg, that's the one that you're going to put on the top of the other leg. Then you're just going to gently pull the other leg forward towards yourself. You can actually even do this stretch while sitting down, so you don't have to stand up. So what you can do, if you want to stretch the right leg, you're just going to put it right on top of the other leg, and you're going to push down. And then you should feel a nice little stretch on your glute area. And this is very basic. You can do it without standing up. Or if you want a little bit better stretch and you have extra time, you can do it while lying on your back. So again, arm, leg on the other leg and just push down. Again, make sure you're not hunching over, you're not arching your back, just keeping straight up. Feel the stretch, hold for 15 seconds and repeat 3 times. And I think that's the end of our exercises. So again, we're offering a free telehealth consultation for workspace analysis. You can email us if you would like that, especially for your kids or for yourself as well. Does anybody have any questions?
So I have posted the link for the MedBridge portal. I have tried to edit all the exercises which Michelle has showed. It says 10 times repetition. You can do 3 to 10. It is not like a hard wall, like how many times you do it. Second is the stretch which Michelle was showing in sitting, like cross leg and like that. In that exercise, it shows in the picture like this going forward. Now when the model is doing in that link I posted, they are going forward from their hips. It's not slouching like that. So it is very important that you hinge forward from your waist, from your hips, not from your low back or from your mid back. So that is the only thing can be confusing. So I just wanted to let you guys know that how to do it.
Okay. Okay. And another exercise, if you guys have a foam roller at home, you can do this exercise. So you can do this either lying on your bed, or if it's a little harder, you can try it out standing on the wall. So what you can do is you're just gonna lie on the foam roller. Important thing to remember is that your head is on the foam roller and not hanging off the foam roller. And an exercise is gonna be called Snow Angels, palms facing the ceiling, and you're just gonna go up like this. Oops. You're gonna go up like this and down. Again, the arms stay parallel to the floor, not going up. I've seen a lot of patients do this number, try to keep it parallel on the floor. Repeat for 10 times. Another exercise you can do is called the backstroke. Again, in this position, with palms facing each other, you're just going to backstroke just like this. Again, keeping your neck, your shoulders relaxed, and just like that, 10 times each arm. Okay. Does anybody else have any other questions?
Can we go back to that slide to Cornell's website, and I can type it out.
There you go.
Yeah. CUE6 program. I think that's the one. I'll just test it. You should be able to get that one. I will, I mean, if not, then I want to add a few things for this webinar, and Kashmira can give her input regarding, Michelle, can we stop sharing the screen? So, all right, perfect. And I'm going to take you off from the spotlight. I don't know. Okay, here it is. Cancel spotlight. Okay, so one thing is very important for the posture is when we are in the side thing and when we are slouching, the shoulder blade comes a little bit forward and you have curvature at your thoracic spine, and at the same time your neck is up. What that does is it's actually restricting your trachea in the front for your breathing tube, and going forward restricts the expansion of the rib cage. At the same time, when we breathe in and out, let me adjust my camera a little bit. The diaphragm is sitting like this. When we breathe in, the diaphragm goes down. And when we breathe out, the diaphragm goes up, and it collapses the lung to take out the whole air, all the air from the lung. Now, what happens is, even though when we are breathing normal, when we breathe out, even after we breathe out full air completely, we still have residual air left in the lungs, and it's called residual lung capacity, right? And that is the home for bacteria and viruses to grow. Okay, so when your chest is not expanding because of the posture and the rib cages are not opening up, your trachea is getting restricted from here. So do not ever try to drink water like that. It will definitely go in your breathing tube and you will get the pneumonia, aspiration pneumonia in the elder patients, they call it. So basically, when you want the breathing pathway completely open, and it needs the expansion of the chest. So during this time, COVID-19 corona attacks on the lungs, and it is very, very important that we have enough lung expansion by being mindful about the posture which is in our control. Posture is generally not very sexy topic. It is very boring topic in general, but right now it's the necessity. It is not the luxury to have a good posture. That is the one thing. Second is, you can YouTube and you can find hundreds of videos on breathing exercises and the yoga and breathing exercises. You can uh, follow it, but basically one simple exercise is you just want to bring your tummy in at the forceful, but you do not do more than few times, 3 to 5 times at a time, because it may make you hyperventilated and you will feel dizzy. So it's like, right? So that forceful breathing out is actually exhaling. Now, people with asthma, you want to be a little bit careful, because in asthma, what happens is when we breathe out, the trachea gets choked. Okay, so when you are doing the forceful, it is going to make you short of breath. So be very gentle if you have asthma. That is the one key. But otherwise, it's very simple exercise, right? And you do 3 to 5 times repetition, about 3 to 4 times, several times throughout the day. And you may get the secretion from the nose. Just wipe it, and that is the good sign. That is the very, very important breathing exercise for the to prevent during this time particularly. And that's my 2 cents of contribution for the posture. Just wanted to touch base with it.
Oh, I can hear my husband.
Sorry, I by mistake unmute everybody, but you can unmute yourself, right? So Kashmira, do you have anything to add?
I'm actually glad you brought that up about the breathing part, because most of us, when we are sitting, like what you said is right, like the lung doesn't expand. And even when we are going out right now, since we have the mask on, that is also not allowing very good breathing pattern, is what I've noticed. So it's the one exercise that you said was very good. I also like this one exercise. When you're breathing, you try to expand your belly a little bit, so you're trying to get more air downwards towards your diaphragm. So for example, when you normally, I've seen a lot of people, especially the ones who are working from home, they'll breathe like this more. Or even in my patients, I always tell them, try to breathe all the way down, like you're trying to expand into your lower lungs. And I don't know if you can actually see it happening right now, but you try to expand into your lower belly rather than doing this, which is what happens a lot. And especially because we are wearing the mask when we are going out to grocery shop and things like that, we still work, yeah, especially during working out, definitely we don't want the mask on. So try to breathe deeper as much as possible between your breaks also. Like when you are taking that 5 minute, 2 minutes, whatever break you're taking, try to incorporate those breathing exercises as well.
So this is very true. And the fun part is we can breathe normal without thinking. As soon as you will think about breathing, you will do exactly opposite than you are supposed to do, right? So what I'm just going to keep myself just 1 minute for the spotlight. So when you breathe in, the tummy is supposed to come out. When you breathe out, tummy is supposed to go in. In, breathe in, tummy out, breathe out, tummy in. So we call it smell the rose and blow the candle, right? So we have to just have our imaginary virtual on Zoom candles and roses, right? So smell the rose, blow the candle, right? So, but again, there are very high chances that you will get hyperventilated, so don't overdo it.
Yeah.
And the only time anybody is allowed to do the upper chest breathing is when the when person is pregnant, because that's why they don't have any room for the expansion of the diaphragm. All men's, we do not have any excuse. Okay, so we have to breathe from our tummy. Okay, so that is the good observation. Thank you. smell the rose and blow the candle out. Any other questions on the posture or breathing or anything regarding, and again, feel free to email us your workstation pictures, and about 75% of the time we can definitely figure out from the pictures itself. Otherwise we can do the video just to check how is your workstation at home, like that. It's like through telehealth, which we are doing for the patients. So yeah, those who are not able to come out, then telehealth can help with that. Very good. So good job, Michelle, you did wonderful on that. There are some more questions. Yes, thank you. Having issues with the neck pain. And yeah, so feel free if you have any question on those exercises, we can go over with the exercises on the quick telehealth meeting, and that's not an issue. Okay, and if you do not have any other question, then we will sign off from here.
Thank you.
Yes, thank you, Ivan.
Hey, Michelle, Pratik, Kashmira, thanks for this session. This is very helpful.
Yeah.
I'm glad you all joined in.
Miss you, Prasad.
Yeah, I miss you all
How are
a
you
lot.
doing?
I'm doing good.
Okay.
Still missing you guys.
Okay.